Hi, my name is Dr. Dave Henderson. I'm the Medical Director for Henderson Wade Animal Society, and I'm going to teach you how to do CPR on your pet. The fact is, it used to be the ABCs, now it's the CAB, circulation, airway, and breathing. You want to get forward blood flow, and unless you get that forward blood flow, you're not going to be successful. We're going to talk about how to identify whether your pet has truly had a cardiac arrest, a cardiopulmonary arrest, or what we call a code. If your pet is breathing, I can tell you that its heart is still beating. So the first thing you need to do is try to assess whether your dog or your cat is still breathing. And the easiest way to do that is to watch for respirations in the chest and behind the rib cage with the diaphragm. Feel if you have any heartbeat, but especially if you have no respirations, that's the next thing you're going to want to do. You can feel over the heart. With a smaller patient, you can use your hand right behind the elbow. With a bigger patient, you can kind of compress over here. You can also look at your pet's eye. You can tap the corner of the eye. If your pet is still blinking, there's a good chance you still have functional brain. If the pupils are dilated and fixed, there's a real good chance that they have suffered a cardiopulmonary arrest. When in doubt, call a code and start compressions. You're not going to hurt your pet if it truly has had a cardiopulmonary arrest because it's already gone. Yeah, you can break ribs and do some trauma, but the truth is if you don't get forward blood flow, you're not going to resuscitate that patient. Focus more on compressions than you will respirations. You're going to have more effect by doing compressions, and actually you're producing some gasping and some airway movement simply by compressing the thorax when you're doing that. The optimum is going to be 100 to 120 compressions per minute, so it's 2 compressions per second, and probably anywhere from 4 to 8 respirations per minute. And if you've got 2 people that can do it, doing simultaneously compressions and respirations will actually probably be even more beneficial. If you've got a brachiocephalic or a barrel-chested dog, you can do dorsal recumbency and compress like you would on a person. I'm a little bit vertically challenged, so I'm going to need a step stool to get up here. Just using your arms is not going to be effective enough to compress the thorax, which you're trying to compress anywhere from 25 to 33% of its normal diameter. So you want to lock your hands like this, lock your elbows, and go at the highest point of the rib cage and bend at the waist. Think about the song, doot, 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 staying alive, staying alive. That basically gives you 100 to 120 compressions per minute. It's easy to get exhausted with this, so if you have 2 or 3 people that can do this over the scope, the time scope of a few minutes, it's beneficial. If you've got somebody that can assist you, like my assistant Kim, veterinarian nurse Kim, she's going to simultaneously, every 30 beats, she's going to do a mouth to snout respiration. And the way you do that is you cover everything, including the mouth, and you blow into the nose. So go ahead and do that, Kim. And go. Don't stop doing compressions, not even for a minute. In a smaller patient, like a toy dog or a cat, you're going to go right behind the elbow, and with your thumb and your 4 fingers, you're going to compress the chest. And you're going to do the same amount of compressions, and Kim is going to do the mouth to snout again, same time. After you've done, say, 50 to 60 compressions, you can feel for the presence of a heartbeat. If you've done this for probably 2 to 3 minutes and there's absolutely no effect, your chances are going down, exponentially by the minute. You can have somebody doing compressions while you're in transit, and don't stop doing compressions, not for anything. In a hospital setting, we can use pure oxygen intubate We also have cardiac resuscitation drugs. So much depends upon A, how long it's been down, and B, what actually led to the cardiopulmonary arrest. Your chances are still not great. So even the chances are not great in a non-clinical setting, it's worth giving it a try.